Okay, it's good to be with you. I'm Quentin Lucas, Mayor of Kansas City. We're here to give you details on the state of emergency we announced. At first, I want to introduce a few of the folks who've been with us along the way. Our Director of Public Health, Dr. Rex Archer, our Director of Emergency Medical Services, Dr. Erica Carney, our City Manager, Acting City Manager, Ernest Rouse, and our Fire Chief, Donna Mays. A few things to note, and I guess to just lead, we've announced a ban on all events of 1,000 persons or more. Those are large events, and those are events. We note that this morning we caught as well that there are 3 additional cases of coronavirus in the metropolitan area. Dr. Archer will spend some time talking about the importance of social distancing between folks to make sure that we're not seeing spread and communication of the disease between folks in some close proximity. And I'll note a few things because we've already received questions relating to it. Where does this apply? This applies to events. The airport is still open. Schools that have 1,000 persons or more are still open. But the types of events that we're looking to prohibit, and indeed that we're banning today, are those of 1,000 persons or more within one space. That would include functions like Planet Comic-Con. That would include sporting events. That would include musicals, theater performances, etc. This will run for a period of 21 days, at the end of which, or slightly before the end of that time, we'll look to reevaluate. We'll see the nature of trends both in Kansas City and nationally in connection with what's going on. We've also announced today at City Hall a ban on all non-essential travel, domestic or international, for city employees. Our goal is to continue to try to contain. We have been in many ways fortunate so far in Kansas City, Missouri, but that does not suggest that we don't need to continue to implement prevention measures and to try to take key and important steps to make sure that we're looking out for the public health of our entire region. A few other notes, and then I'll get out of the way for Dr. Archer. I've been in conversation with several superintendents of schools this morning. This is not an announcement as it relates to what schools are electing to do. They continue to go through their own evaluative processes in the best interest of their school buildings and their school districts. And I know they're talking to each other, particularly the school districts in Kansas City, Missouri, all 14, in connection with what is the best approach for all of them, largely in a unified manner. So that's one thing that's of importance. Another thing I want to note is this. There are some who will be angry about any number of things that will be closed over the next several weeks or perhaps longer. Trust me, we are in the business of collecting tax revenues and that sort of thing, so we don't come to these decisions lightly. But we understand that it's vital that we take an important leadership position on prevention. Even though our city has not seen the same flare-ups that you've seen in places like Seattle and Westchester County, New York, etc., we think it's important that we try to make sure we avoid those problems. We think the steps that we're taking today will buy important time for our public health, public safety infrastructure. We think that it will allow us to make sure that we're able to be prepared for any challenges in the future. And frankly, we think this is necessary to keep our community safe. Everything we've said before continues, right? If you're persons in at-risk groups, if you're some who have been subject to illnesses before, if you're folks who are of an older age, we continue to encourage you to take as many steps as necessary to protect yourself. And importantly, and something I said the other day, if you're somebody who is not in one of those groups, it's important that you follow many of the guidelines that we've announced today, making sure you're following good hygiene, social distancing, etc. Everybody has a role in making our community safe, and we think this step is important for us in connection with that. I'll be followed by Dr. Archer, then Dr. Carney, and then we'll be available, myself, the city manager, and both physicians for any questions. Dr. Archer.
Thank you, Mayor. So the actions that we're taking today are a small part of how you stop these types of outbreaks. I want to emphasize that. There's a huge amount of personal responsibility, as mentioned, stopping handshakes, not even doing fist bumps because you can still see bacteria and viruses transmitted that way. We're even moving a little bit away from the elbow bump because that's actually where we're telling people to be sneezing. So think about, just greeting people with a hand over the heart or the namaste. We need to break this cycle to keep this virus from moving around. The other part that I want to really, really emphasize is these measures will help some, but for those that are high risk, and high risk is defined as anyone over 60, anyone that has heart disease, lung challenges, immune problems, you need to be thinking seriously about, would you even be in a room like this right now? Once we start seeing person-to-person transmission in the Kansas City metro area, we wouldn't have a meeting like this. We wouldn't have you in this close together. When we had a meeting at the chamber, we started separating things out. Dr. Carney and I will kind of demonstrate you need to be far enough apart that you can't touch hands and there's some space in between. So if we're queuing up in lines for whatever it might be, elections or anything else, keeping some distance is important right now. If you're over 70 and you have any of these pre-existing conditions, I'm basically telling you as a city physician, you really need to be careful about this. Don't go to conference rooms or that. It doesn't have to be a 1,000-person event. It can be 25 people in a room of this size that is starting to put you at risk. Also, we are working with our nursing homes. Most of them are already taking strong actions. People should not be visiting folks in nursing homes right now, particularly once this starts taking off.